color, light, brightness, depth, and detail. Our eyes reveal the world to us. And in virtually every community in our state, there are doctors of optometry dedicated to helping people protect and improve their ability to see, understand, and enjoy the world in which we live.
Every day, our vision is allowing us to live the best life possible. So if we can prevent any sight-threatening conditions, or if we can help somebody just maintain the highest quality of life that they want, then that is really very impactful on a person's life.
Most people would say the sense of sight is their most important sense, most valued sense. And we've been trained and have the ability to restore vision in some cases and preserve vision in other cases.
People want to come to us, they want to see better. So what we get to do at the end of the day is we get them to see better. That can be with glasses, contacts, low vision devices. That joy, especially, if you have a little kid who's getting that first pair of glasses, that joy you can see on their face when their face brightens up and they can see their world better, that's a great feeling to have.
I just love when I can change a person's vision. And vision being their sight, but also their outlook on the way that their life can be because of improvements that we can do to their sight, to their vision, and therefore how it affects the quality of their life.
Every day, in virtually every community in Indiana, doctors of optometry are making a difference for people of all walks of life.
I find that if I can help a patient understand what's going on with their eyes, they can care just as much as I do. We're able to work together in maintaining their eye health.
A lot of things with the eye are silent. So I always tell my patients they're silent eye diseases. You're not going to know that you have them. Glaucoma, macular degeneration, diabetic retinopathy, just a whole host of different things that can come with the eye. So it's very important to have those things done in person with someone who knows what they're looking for.
The human eye is a highly complex entity. Understanding it and caring for it requires a dedicated education process. Every doctor of optometry first completes an undergraduate degree, focusing on critical required coursework. Optometry school itself consists of 4 years of doctoral level study, concentrating on the eye, vision, and related systemic disease, with coursework in human anatomy, biochemistry, physiology, and pathology, as well as pharmacology classes.
We train our optometry students as basically primary healthcare providers. So we train them to care for all aspects of the eye and vision, both with devices, glasses, contact lenses for vision, things like that, medicines, minor surgical procedures, laser surgery procedures, injections of different eye care medications in and around the eye, and to also involve themselves with systemic disease processes that can be recognized in the eye and help the patient with their systemic issues as well.
Optometrists are very much like the primary care doctor for your eyes. They can act as the liaison to get you to surgical care if you need it, and many times it's acting to get you to subspecialties, neurology, endocrinology, rheumatology if you need it from a systemic health standpoint.
The benefit of being so focused on the eye is that what I've come to appreciate being in optometry is that it's a lot more complicated than I could have ever imagined. As optometrists, we treat, diagnose, and manage over 250 eye diseases, so there's a lot to learn. So I think the benefit of having 4 years dedicated solely to the eye is that you have now doctors that are very well versed and their expertise is really focused on this very important organ.
It has been said that the eyes are the windows to the health of the patient. And that has certainly been true for countless Hoosiers. Indiana's doctors of optometry are the primary healthcare professionals for the eye in our state, often detecting and diagnosing eye diseases such as glaucoma, cataracts, retinal disorders, lid disorders, and infections. And of course, helping people of all ages see better through the use of glasses and contact lenses.
In my practice every day, not only do I see the patients that are coming for glasses and contact lenses, but we also have patients who have been referred in from their neurologist, most commonly for MS. We have patients that are referred in from their rheumatologist for a lot of autoimmune conditions. And then we get patients that are sent in, maybe they're going to be undergoing hepatitis treatment and they have to have their baseline eye exam. And all of these professionals and other specialists rely on us in order to ensure that those patients have good eye health, not only before as a baseline, but also during their treatments to make sure that anything they're prescribing isn't affecting their vision or their quality of life.
I definitely think that we can help kind of promote overall health because there's certain aspects of optometry that I don't think people realize deal with the majority of health. Like we can see diabetes in the eye, blood pressure in the eye, high cholesterol.
Across Indiana, optometrists also provide vision assessments to infants at no cost as a public health initiative.
A lot of times children go into school, they don't know that they have blurry vision because that's what they've lived with their entire lives. They don't know to tell their parents, I can't see. And it's not until they get into school and they can't read their homework or they can't see the board at school that we notice that something is going on with their vision. So if we can catch those cases when those children are very young, then we can address the issue of vision loss or even just blurred vision so that when they get into school, they can be at the highest academic level that they're able to be at and they won't fall behind in their education.
Just seeing a child that comes in who has visual impairment and after treatment, you really see them take off in school, they're doing much better academically, and you just know that you've made a long-term impact on that kid and then hopefully society.
For older Hoosiers, doctors of optometry are often instrumental in discovering sight-threatening conditions, such as diabetic retinopathy and macular degeneration. And for many patients, Indiana's doctors of optometry are providing laser surgeries that can both correct and improve vision.
My initial cataract surgery was in Indianapolis. So I had it on a Monday, and then the next day I went back on Tuesday and had the other eye done. And then on the third day, I came here to my local optometrist, Dr. Cameron. About a month after my cataract surgery, Dr. Cameron, he told me that I had secondary cataracts, which I had never heard anything about and didn't know anything about that. So I had to have that procedure explained to me, and he said I can take care of them right here in the office. And he said it just painless, it just takes a few seconds, and it did, and it was wonderful. And I had that one done one day, and then the next week I had the other eye done, and that's it. It's so simple and easy, right here, local.
So I've seen Mariana for a long time. I see her for a comprehensive eye exam. She had cataracts. I had to send her down to Indianapolis for cataract surgery, and then I saw her afterwards for a post-operative care. After following her, we noticed that the implant, after cataract surgery, the backside of the implant had become cloudy. That's called posterior capsular opacification, very common with cataract surgeries. What I did is I brought her in and I used a YAG laser to clean off that cloudy material to help improve her vision. With that cloudiness, that film on the implant, she was having, glare, cloudy vision, blurry vision. So once we clean that off, it helps her see much better. It was nice for Marianne because she lives in town. I've seen her for many years. I didn't have to send her, 45 minutes, an hour away to have this done. She could just, pop over to our office in town and I could do that treatment for her.
I feel blessed. I'm glad that I had the cataracts because I don't wear glasses anymore, and I could come local, and I'm thrilled with Dr. Cameron that he could do all those procedures and follow-ups and do everything right here in the office. Now my eyesight's perfect.
Today, Indiana's doctors of optometry are at the forefront in using many advanced technologies.
There's always new instrumentation coming along, and we certainly at the school try to keep ourselves availed of the newest and the greatest technology to teach the students and prepare them to practice that way when they get out into practice. Imaging technology to image the retina at a cellular level, even really a microscopic level, if you will. Other types of technology that really improve how we're able to care for people's eyes.
Indiana's doctors of optometry are dedicated to the future and helping communities statewide have the best eye care possible.
Indiana Optometry, we are small business owners, and we're really involved in the community. We have not only our patients in the community, but also our employees that we're caring for, and really making sure that we're tied into the local community.
I think one of the benefits of optometry is that we span the entire state. We're in the urban centers, we're also in the rural areas, and so we are often a small town's hub for health information. So we are well versed and understand the public health needs of the community. We can convey that and be an expert in the community to help individuals when they have questions.
So yeah, the future of Indiana optometry is very bright. We're able to perform some injectable procedures, advanced laser procedures. The more we can do for patients in general, the better care we can give them. With Indiana being a larger rural state as well, if we can keep them very close to, their hometowns, they don't have to travel as far for care. And that way we can be better healthcare providers in all aspects of their life.
Indiana's Doctors of Optometry, providing comprehensive eye care for the people of Indiana.